pain is a really common problem, as 80% of our population will experience some form of back pain throughout the course of their life. And usually this is because as time goes by, our body starts to break down and degenerate. So in this instance, this is where actually some of our current events and the inability to go into the hospital system, or the fear of that, really led someone to looking for alternatives, and they found me. Now, when I first talked to her, I asked her, what is your pain level on a scale of 0 to 10? And she gave me a deadpan answer, 12. 12 out of 10 is beyond my imagination. So, and this wasn't just day-to-day pain. This was a knife-like stabbing that started in the back and glute and traveled all the way down the leg. It was so bad that pretty much any movement was a challenge, including getting out of bed, trying to put on socks, getting out of a chair, even lifting up a leg to take a step. Now, when we started working on this case, she had already tried medications and had 2 rounds of muscle relaxers and a steroid. She'd also been seeing a chiropractor for the last 20 years where, that would help her avoid intense pain, but never as bad as what she was experiencing now. That's why she actually drives from about an hour away to come find us and our approach. Now, when we looked at what was happening here, we got in, and by the 3rd visit, her pain was down to a 3 out of 10. That is a huge change from a 12 to a 3. Furthermore, she continued to improve, and when we talked about what her problem was, we were able to list the exact nerve root that was being compressed and let her know this is what your MRI is going to show. When we got the results back, it was exactly as we predicted. This is common with the way that we practice because our functional tests are so powerful at predicting the situation, and with 10 years of experience, I've seen almost everything that can come up. So what we want to do is make the functional progress, and now she's actually been golfing again and swimming, and this is only a month after I met her. So these results are phenomenal. She's ecstatic to be back to living her life, and now she's looking forward to retirement at the end of the year, as opposed to wondering whether her body is going to hold up. And I'm really grateful for the opportunity to see her, because I get it. It's hard to create the time to find a provider. It's even harder to get there when you live an hour away. But she found the time, and now she's gotten the results. That's why we're here, to help deliver results every day.